Morning, everyone. So, may I introduce Dr. Jeon? She is a clinical psychologist trained in New Zealand, running her private practice in Auckland. She believes that there is no individual trauma, but all trauma is relational and interconnected. That's what Gayatri was presented before. As she witnessed, this is her everyday clinical practice. Hyunok is an internal family system therapist with level 1 and 2 training and EMDR therapist with master level training. She worked until recently in public mental health settings as a consultant psychologist, meeting many people with historical and complex trauma. She has been working with ACC for a number of years and as an assessor and a therapist for survivors of sexual trauma. Let's welcome Dr. Jeon. It's all up to you.
Hello, hi everyone. Lovely meeting you guys.
Share.
Yeah, do you hear me okay? All right, yeah. Okay, it's lovely meeting you all in this Friday morning. I briefly just introduce myself. My name is Hyunok. I'm a clinical psychologist. I'm originally from Korea. I landed in this country about 20-something years ago as an adult. I had my degree and I was working in Korea for some time, and I sort of thought, oh, I might just give it a go, something new before I got married, because I don't know actually, because at the time in Korea, once you got married and get children, you kind of get tied up. So, no, I will do something before that. So I left Korea at late 20s, I just came here some kind of overseas sort of experience for a few months, and I was lucky to meet some new good people and got to know about this country a bit more, and I decided to stay a bit longer, and that was a little bit easy time for us as a young woman to get a job. I remember I worked as a tomato chopper in a sandwich shop. I was so bad. I got almost sacked, and I was kicked out from the chopping position, from dishwashing position. So I managed to survive. So I made a little money to enroll in an English course. I started learning English. I spent most of the time at English school sleeping, not just like that. I just couldn't understand a single word. Then I managed to get a little bit better paid job, because I was working as a junior journalist in Korea. So I got a job in one of the Korean newspaper companies, and I really enjoyed it actually. I didn't need to use English a lot at the time in the company, because everyone is Korean, but I met some successful migrants, modern migrants who came here. Learned a lot, studied a lot, worked hard, and so got a good job, like lawyers and what are the good jobs people say? Oh, doctors and architects and business people. So I met a lot of successful immigrants, and I just a lot. You don't need to chop tomatoes all the time. You may be able to do something better, or something better at me, because a bit better at, because I wasn't good at tomato chopping. So that's how I started thinking about studying and becoming a professional as an Asian woman in New Zealand. Yes, I think I took some time to finish my English course, and then done my master's. Oh no, what was that? Anyway, some sort of courses to finish my doctoral degree at clinical psychology at the end. So that was about 10 plus years ago. So now I have been working in the DHP setting nearly 10 years. I just get out of there. A very, very good place for me to learn and get to know about this country and the system, because, maybe some of you guys know quite well that public community mental health team in DHP is the place where the most vulnerable people get cared No. Lots of people from very low socioeconomic status, people from many people from minority ethnic groups. Of course, there are lots of Pakeha folks as well. Historical trauma, intergenerational trauma, moms and grandmoms and aunties and uncles. Many people are traumatized in the family, small, very little resources, but somehow they survived. So I just learned so much working with those people. Also ourselves, we are also people who are struggling to work with these such marginalized people with very little resources. So I'm pretty sure as a clinicians, we are somehow on daily basis hurt and sad and felt quite little resourced. So you need to be very creative, sometimes having to work together. So it was a very good place to learn. Now I'm working full-time in private practice. I'm sharing my presentation material. So how do I do this? 하이할까? While I was listening to the previous presenter, because she's given such a succinct, beautiful presentation about trauma and what kind of trauma, I sort of thought I might change a little bit, but we'll see how it goes. So no, we see many people who are traumatized, obviously. I heard that the people here are usually mostly from some kind of organizations or clinics who are working with people with trauma history. So, okay, I don't know how, but it's not working in the way. Oh, never mind, let's go with that. So yeah, I'm gonna talk about trauma assessment, but culture in mind a little bit. I just want to ask Joanna how much time I've got. It's sort of changed, right?
Yeah, you have until 10 past. So you got about 45 minutes.
Okay, all right.
Excellent, yeah. Good, thank
okay.
you.
So when we see people, someone is walking in our door, right? And we haven't met the person yet, and we need to know who's walking in the door, who's that? No, of course they start talking about what they are struggling with at the moment. I can't focus, I've got a relationship messed up, or no, I can't sleep, I eat too much, I can't stop drinking, or whatever. I've got a boss that I can't even speak to, I'm bullied. So there are lots of things going on. That's why they are here. And sometimes, often we don't ask lots of histories straight away, right? But we are already opened up, looking for, our radar is up there. We are looking for some clues, and that's our job, right? So how those issues relate to the other things? What is the big picture? What is the bigger picture that's here? The trauma, that's something we sense somehow in the room. The person feels somehow in danger. The person may feel or afraid of some kind of betrayal. The person may feel, what if I'm rejected, or I felt rejected. That's kind of big signs that I sometimes sense from the person next or in front of me. That's what I'm sorry, I just can't remember the name of the previous presenter, sorry, but she mentioned about physiological and psychological impact of the trauma, right? So when we sense the danger, especially when it happened younger and when we feel very vulnerable, the danger affects our nervous system, right? And it often quite interpersonal. It can be quite relational. So if we are betrayed by someone I trusted, it's very profound pain, and we may feel rejected at the end. So I'm not important, I'm not lovable, I'm not belong here. So that's kind of very big 3 marks that people when they are traumatized, and somehow whenever people are walking in the door, they may have some of those issues hidden somewhere. Yeah, it's just as I said, usually when people experience extreme danger or perceived danger, a fight and flight and freeze system come up, right? So either we want to run away or we just shut down. All very good, effective survival mechanism. And if we feel betrayed, we start feeling a little bit difficult to trust people. So our relationship with others are in trouble. And if we felt rejected, then we feel shamed. And then the relationship with myself, it's profoundly disturbed. So they happen, right? So when those things happen, what happens is that actually trauma blocks love and connection. That's I think that's the most significant damage that we are getting from trauma. We get lots of trauma from from the birth or even before the birth until now. What is that? Okay, yeah, and I'm pretty sure everyone in this room somehow survived from lots of small T trauma and big T trauma, and we kind of get sensed, no, I'm not too sure whether it's okay for me to show myself. Am I going to be accepted? Am I going to be loved? Can I approach that person? Is it going to be safe? But I like to approach, but is it going to be safe? Am I going to be safe? So all those questions and suspicions and the fear, that's the result of the trauma. So I like this statement, this trauma, the most significant impact of trauma is the blocking our link to the love and the connection. I will just give you a little case. It's not a very big problem, a big complex case, but I heard about this case from a presenter in a conference recently, and I thought it's quite lovely and touching, but very sad, and also a realistic scenario that we hear all the time. So this is the case of Kai. She is now adult, but she was 6 years old. She was a Vietnam girl living in the United States. And her mom, usually quite vibrant and bubbly, and she's very confident. She's always in control of the family. So the kids feel like, oh, mom is the boss in the household, right? And they went out to the park and they have fun. And the mom, I don't know what happened, but somehow the local people approached and the mom talked to them, and they were a little rude. They were a little rude. They were white folks, and they talked something a little bit mean to mom. And what happened is that Kai felt the mother's fear. The mom didn't say anything. The white folks didn't say anything to Kai, but Kai felt the mom's fear, not here, but from her tummy. That's what kids do, right? So she just viscerally, she just felt the distress in the tummy. And now, 30 years later, what she's saying is that she's a very confident professional woman, but she somehow always has to deal with strange internal conflict. That like she knows she's born in the United States. She's she feels always belong to the friends. There are lots of good local friends, but somehow she always has the tummy problem. She never felt entirely comfortable surrounding with those white friends. She's very, very struggled with that. no, she had years of therapy, and no, it's not a therapy that she was getting because she's having mental illness, but no, she talked and she thought, she reflected, and she remembered the 6-year-old girl that was sitting somewhere in her internal world. And that is the girl, the 6-year-old girl, sending the signal to Kai. Even Kai is now 30-something, professional, very confident woman. The little girl was sending to Kai, what if you get hurt again? You saw your mom. You felt mom's fear. She's such a confident woman, but she was so scared in the park at the time. So that's in her tummy sitting there. So no, the impact of trauma, it's not always clear, or it's always just right in the front that easy to detect, but it is there. No, I like this kind of a way to look at trauma. So for Kai's case, it seems like the mom seems the one who are traumatized, but we can see the impact on Kai, right? So in Kai's tummy, there is a wounded part sitting there, 6-year-old part sitting there. And what Kai has been doing, she's working hard, she's academically successful, she's got a very good job, she's very confident professional woman, right? So she has developed different parts who can protect the 6-year-old girl. Even she might have thought of protect her own mom too, right? So she's got a different parts in her internal world, who's perfectionist, who's hardworking, who's very caring, and who's very, very confident. So this part who are the actual managers, right? The manager part who is who are coming up later. Maybe one of the managers came up just on the same day. Oh, I actually have to pretend as if I'm okay. I can't make my mom more distressed, right? So she might have a little preventive and protective part already created or at the scene, but maybe she may have a little later parts who have more consciousness. Oh, actually, if I want to be if I want to be able to protect my mom or some others in this situation, then maybe better to have a better job. Now, better to have a this kind of attitude. So there are lots of protective parts maybe might have created. I can see from we can see from it very easily, right? And she has issues of eating sometimes. Sometimes she just eats. She measures very precisely how much she eats and how much weight she may have gained or lost. But sometimes, no, she just eats a lot. So there's a reactive part who the managers and those protectors working very hard to protect this wounded part, to protect the scariness, to protect the fear. But sometimes it's a little bit too much, can't keep going like this. And sometimes it needs to just explode. So that's kind of reactive part she also having in her internal world. So being able to, for her to be able to see all these parts inside of her and start having more understanding, starting having more understanding of why they are doing this job for me. Some of the manager parts are doing this job because they don't want this wounded 6-year-old part feel hurt again, right? And those eating, eating part maybe just gives her some opportunity to breathe because it's too much. She's working way too hard. She's way too perfect. So she needs to whatever. Oh, I'm gonna just finish this whole box of chocolate, whatever. So she needs to have this sort of space to and just go crazy. So once Kai start understanding all different those parts are doing for her, she started feeling a little bit compassionate and curious. And she also have some caring mind for all those little parts inside of her. And she may become, she may come up with a little bit more creative ways to look after them or look after this wounded part who's sitting there for how many years, right? So that's something, we actually look at the consequences of trauma, but also the way we can grow out of the trauma, if that makes sense. In a nutshell. So if we see the trauma blocks love and connection, maybe love to others, love connection to others, but also love to myself and connection with myself. Because sometimes connection with my wounded and little parts can be quite scary, right? It's distressing. So we sometimes dissociate, we sometimes numb ourselves. So the difficulties with love and connection is not only with others or the world, but it's also within ourselves, with my own part too. And also it can teach us that actually love and connection can heal trauma. Why not, right? So if I want to start feeling love and connection somehow, then maybe the scar from the trauma can be recognized and can be a resource. That we see a lot from our for the upper generations, right? And I think it doesn't matter whether it's we are colored or white people. Everyone has trauma historically. And I had an opportunity to hear from my white folks, one of the white professional male persons. He's talking about the guilt, the collective guilt that he had privilege. He was a part of the oppressors. I think that's indirect trauma too. Let alone on all the trauma that colonized people and the third world people, the ethnic minority people gone through. Okay, so let's come back to the more sort of traditional talk of trauma. So when whatever it's a small trauma as Kai has experienced, or it's a bigger trauma as like my son was killed in the war, or my husband was sent to the camp, or whatever. Whatever the trauma is, it affects our implicit memories, which is the memory that we don't see, we don't talk a lot about. It's more of the, if you see someone is walking the door, like it's my office, someone is walking, and if I open my mind, then just to see the whole person, you kind of get sense, the body language, the facial expressions, the way the person approaches me, whether the person sits at the left side of corner of the couch, which is closer to me, or the person sits the right side of a couch, which is further from me, or someone wants to sit close the door or close the window. No, there are lot of information immediately from the person. That's all implicit memory the person is showing unconsciously. So we can see trauma is more likely to be remembered in the form of sensory elements with the words, for example, emotions, body sensations, and breathing, heart rate, tense, whether they feel like they're collapsing, they feel always tired and fatigued, or sometimes they feel overwhelmed. This type of, yeah. Janina Fisher, published this book quite recently, and she's providing very good description about this. If you guys are more interested in, then maybe useful to have a look. The last thing also, especially the clients with ACC claim, the sexual trauma claim, I feel now almost it's normal to hear this kind of description. I have these symptoms, but I don't know why. So I've got symptoms, but there's no reasons, no stories attached. Many people don't remember exactly what they have experienced as a child, because the trauma have trauma imprinted in a more impressed memory area, like our nervous system, the way we interpret the world and things like that. So people may not have a clear description about what happened, what they experienced, but they still bring their symptoms very, very clearly. Okay, I think it's mentioned briefly, it can be a single traumatic event. Look at right. If you had no trauma but only a single car accident, it can be quite traumatic as well, of course. Yeah, and sometimes repeated trauma, many similar events happening or different events happening but repeatedly. And it can be repeated also relational trauma. Relational trauma tend to be quite repeated, right? Because you tend to be traumatized by the person who living in the household or nearby. So interpersonal relational trauma are usually repeated, prolonged, especially when we are especially vulnerable as a child. So developed trauma can be similar to related trauma, but it's usually affecting us when we are rapidly developing. So if we are like a 3 and on the 3, or if we are in mom's womb, the trauma can make an impact slightly differently, right? It can impact the hormones of mom. It can impact on the nutrition of a baby, the chemicals interacting with the mom during the baby was in the womb. It can be because that when we are in mommy's womb, that's our the primitive nervous system is almost formed, right? It's like a brain stem or emotional brain. So if mom was traumatized severely during her pregnancy, I'm not surprised the baby came out with less capacity to regulate the emotions or even recognize the emotions. It's always very little when they were born, but if the structure when they were in the baby mom's womb, if it's not provide a safe enough environment, it's pretty obvious, right? And that's when we are when it's during the pregnancy, but also after the birth, like between 0 to 3 or 3 to 5. You guys may heard about those critical times of development. It's not fixed, but it does indicate what window is open now and what window is going to open in the next stage. So if the person has a severe trauma, relational trauma, betrayed, rejected, and lack of, it's not only emotional, if lack of food or lack of attention at very young age, the basic primitive functioning will be affected. And if they are and if they are assaulted or abused in a teenager, their sense of identity and their capacity to think in a metacognitive level will be affected, because that's when the prefrontal lobe is getting matured, right? So we know, when we are adolescents and teenagers, we know a lot, but we are a little bit less capable to make wise decisions, because it's still prefrontal lobe are developing. It's not developed quite well yet. So if something happened during that time, the way the capacity to make what decision and regulate others, emotional problems, it's going to be affected. So that's why we that's why there's a name for developmental trauma, just to look at the developmental stages that trauma can affect. And also cultural and historical trauma that we are all quite interested at the moment. I guess also with the COVID-19 issue, the collective trauma, because the cultural historical trauma usually collective. The collective trauma is becoming on the surface. We became more interested and became also the current victims of the collective trauma right now. So I think it's no, it's not good that we are collectively traumatized at the moment, but it's good that we sort of start paying more attention to this topic. If you, I think many of them already noticed that there are a lot of discourse and discussions and interest around this kind of trauma at the moment. Okay, I'm not gonna go through that because it just mentioned. So let's skip. Right. So if the single event happened and someone is not well cared, because if we have, I might just mention briefly, if we were exposed to a single traumatic event, the traumatic symptoms for about a month, it's very normal. You need to have that. And that's when we became an agent for natural healing. So we all have the capacity, we can heal from a single one event trauma, and you can't heal on my own. We need support during this time. So if in this acute trauma phase, if we have good enough, it doesn't need to be perfect, good enough support from others. And if we were in that kind of supportive environment and validated and nurtured, then it will be fine. That's the theory, but you can see a lot. If there are tremendous trauma occurred in a village, but if they support each other, there are always a sense of connection. It's kind of managed. I can't remember the study, but there has been a study in somewhere in Africa that there are less prevalence of schizophrenia after a very traumatic event compared to other area with there's a similar kind of degree of event trauma happened in the community where the country in Africa had the village had very strong community connection, but the other group in other countries, they didn't. They kind of lost their traditional connection in the community long time ago. So I think that makes sense. And if people don't have this sort of support during the first month or 2 months, then and everything is on the individual to deal with. Our nervous system can't do that. We need another nervous system to stand fine. We can't stand with one leg. We need another leg to stand. So if there's no other nervous, no other brains available, then it's not good. So people, obviously develop something. And one of them is PTSD. So it's more chronic trauma symptoms. They last more than a month. And some of them are more risky, more vulnerable to develop PTSD or other mental illness. If the event themselves are way too distressing, so peri-traumatic distress is too high, then it's a risk factor. And if the person has been exposed to trauma before, of course, it's a risk factor. And as I said, if there's no good enough support, that's another risk factor. And it's emerging research area. So if there was a previous trauma, but it didn't happen to the person directly, like it happened to my mom, it happened to my mom's mom or mom's dad. No, it just somehow leave the person a little bit vulnerable to the later stresses, even if that didn't happen to the person directly. So it's the previous presenters mentioned epigenetic studies showing it as an evidence nowadays. Many people are now attending to cultural trauma, cultural legacy, generational legacy, cultural burdens too. I will skip that. Complex PTSD. We just look at this one briefly, right? The Judy Herman is the person who's mentioning about complex PTSD. So he realized that because she worked a lot with people with sexual trauma and people who are traumatized as a child, and she just realized that PTSD diagnosis PTSD is not enough. It's not enough. There are lots of other things going on, and we need a little bit broader definition of something to recognize those people. So that's how complex PTSD came up, and it's now quite well recognized diagnosis, right? It's not in DSM-5 still, but it is in ICD 10, I think, yeah, or 11. So what complex PTSD is saying, in addition to normal PTSD symptoms, is these three. So emotional dysregulation and interpersonal difficulties and negative self-concept identities. So if we see people like with a personality disorder plus lots of other things, exists one diagnosis like depression or social anxiety, or troubled eating, no, they may fit somewhere here. So they do have PTSD symptoms anyway, flashbacks and hyper-alertness, avoidance, all of this. Plus, they will have difficulties regulating their emotions. They always have problems with people. And they kind of have a sense of self. It's quite empty, quite fragile. Yeah. So that's kind of common pictures when people survived from complex trauma. So I will just briefly show what complex trauma is. So it's usually repeated, ongoing, very prolonged, and the victims or the survivors would have felt that it's impossible to escape, for many reasons. And it's usually occurring within a personal relationships. So someone who I know, maybe the abuser, usually started in the childhood. So it does make a profound effect in our brain and normal development in many ways. And usually they are secret. It's all kept secret. So people either don't say it because they are afraid, or sometimes they just dissociated effectively to survive. So they have no memory, and it's never talked in the community or in the family. So it's a big secret, or even if someone has questioned, it's denied. It's pretty common pictures. You may see many people like that in Jaru. We don't normally see people with single trauma, right? So single traumatic event, even if you are a therapist or social worker, whoever, most people we see, come to our attention, gone through those kind of trauma and having these kind of symptoms. So how I'm doing, cultural trauma. Okay, we mentioned a little about cultural trauma. I just put a few references here. Yeah, I don't think we can go through all that, but yeah, as I said, intergenerational trauma, quite well known now. I'm pretty sure there will be more research coming up. And thankfully, when we are talking about cultural trauma before, it was told like, so you are victims of your mom's or your grandmom's trauma. What the heck? It's like even when we start talking about trauma, even if I was sexually abused as a child, if you say that, that's many years ago. How come you are still struggling with that? Get over it. No, that's even a very strong opinion in mental health field, even some time ago, right? So it's only recognized when veterans came from the war and they are severely distressed and unable to continue normal life. the PTSD is finally officially recognized. So if someone says, oh, actually I'm struggling because my mom's mom was raped in the war, who's gonna listen to that? But now the epigenetic studies came up and it's actually showing, it's affecting our genes before pregnancy, during the pregnancy, and then the environment will reactivate, provide the circumstances to reactivate with the epigenetics in our body. So no more nature nurture debate is a debate anymore, right? So we've got nurture and we have nurture, but it can't be shown without nature environment. So I think I messed up anyway. So that's something, it's quite a fascinating area. All right. I don't know whether I've got time for that, but I mean, just briefly describe another case. So she's a 59-year-old. She had a repeated assault from her partner many years. She's got very severe PTSD symptoms. She was diagnosed with dependent personality disorder, and she's not reporting any trauma as a child. So when we said only that, oh, maybe she was very severely abused by her partner, that's the problem. But actually, if we have more information, actually she's a Korean woman, and her mom was married to her dad when she was very young. She was sold to the wealthy family to get married with their son, because she's very beautiful, and the wealthy man's son had a little problem. So she was sold to this wealthy family when she was very young, and the mom, the young girl who married to the wealthy boy, she, the way she was survived is just being compliant, to the wealthy, parents-in-law and all their relatives. So she stayed there, compliant, quiet, just being pretty, and raising her own child very quietly. And also the mom had to save some money to provide some food for her own family, because they were so poor. That's why she was sold to this wealthy family. So growing up all these years with mom, surviving like that, for this lady, for this 59-year-old Korean woman, for her to be independent is a death sentence. She never seen it. No, she's never seen a woman being independent and okay. She only saw a woman being dependent so that she could feed her own family, so she could protect her own children. So for this woman, it's way too difficult to be independent. I'm not surprised she was not able to get out of the relationship for 20-something years, right? So that's the intergenerational trauma. No one hit her when she was a child, but she saw her mom surviving like that. Yeah, that's another one. I just shot one. It's not a case, but I read this short article from psychology social journal here, and she's I think Tariana. She's a very well-respected Maori psychologist, and she said the consequences of colonial oppression has been internalizing the image of the oppressor in Maori's mind. So the violence, the invalidation, it's somehow internalized and imprinted in Maori's mind, and that's the consequence of the colonization. It touched me actually, because myself from Korea, we had a horrible war, Korean War, and the men are so violent, get out of the war, and the men from the army, it's the army obligation is the compulsory for all Korean young men who's got Korean citizenship. And nowadays they say it's a little bit better, but even when I was in Korea 20 years ago, my boy peers, my university friends, my friends who get out of the military system, they somehow learned how to be violent when they need it. They somehow learned how to be small when they are going to be attacked violently. So it's sad. Okay, they just talked about Korean War, right? I also had a chance to hear a beautiful young woman, Ariana. She's I think she's a therapist practicing Ukraine. She was talking about Holodomor. I didn't know that. And I was surprised that I didn't know. I'd never learned it from my history class. But it sounded so horrible thing happened to people in Ukraine. So those years, for 2 years, they didn't have food because all the crops they cultivated from the field are taken to Russia. And they will have severe punishment if they hide some food for their kids. So many kids, many women, many pregnant women and babies died, including young healthy men too, because they couldn't eat. So it's a very severe genocide happened 2 years. And what she said is that it never spoken. No, it's so traumatic. People didn't talk about it. Once they are survived, that's it. Of course, she found that from her observation, there are strong distrust in authorities in their culture. And there is a fear for life, a fear for saving food and things like that. So no, it's still there. And it happened many years ago, but it's still there. The survivors with these strong feelings, they raised their kids with these strong feelings. So they've got very strong protective mechanism in there, right? So they happen again, or even if it happens, my kids can be safe. And now maybe, also she's observing that there are gifts too, so there are skills we share to function despite the level of difficulties. And we are persistent, we became very creative in getting resources and surviving. So I guess those kind of histories, it stays in many ways. We know the survivors and the further generations of Holocaust, and what kind of struggling, what kind of gifts they've got. All right, so I think I'm nearly finishing. Yeah. So I guess for me, my learning points from all this experience and learning and what's that? I need to be open-minded to not only told and known stories, but unspoken stories. And also very close attention to the non-verbal presentations, as I just mentioned before, the way they walk in the room, the way they sit, the way they look at me, the way they, take a break. Even I say, oh, well, you said you talked without, you talked continuously for 20 minutes or 30 minutes. What if you just take a breath? Oh, no, they can't do it. Yeah. Attend to our felt sense while interacting. Yeah, same thing. So I try to use all the senses, not only my ear, but my sort of any instinctive sense that is there. That I like to use that. Not always, but I don't always ask directly, but sometimes if it's coming, then I listen to it very, very seriously. Someone says, oh, actually my nanny's dad was in a camp during the World War, but no, we don't really talk about those things anymore. So I think it's fine now. Something like this. If wow, okay, I listen to those stories quite closely, carefully. I don't give feedback straight away either, because I don't really want to freak out a person. But I might think, something very traumatic happened. For the earlier generations in this family. and how this family have dealt the trauma. No, I might just look for the family culture shaped out of it. Also, no, it's nice to have some time to notice my own cultural legacies, what I am carrying with myself, and that also helps me to approach. So look for create safe connections and some kind of spaces that I can share. So it's kind of for me antidote, for being secretive and isolated and dissociated. I need dissociation. I don't really want to really think about some of my relatives who are early generation who suffered in the war or colonization, right? I don't want to think about all the time, but sometimes, just take time with a compassionate mind to myself and to the group that I belong to. What might have happened? How my moms and my grandmoms might have coped. Something like that. Yeah. Okay, so that's me. Yeah, thank you so much. Any questions if you've got time? Any feedbacks?
Thank you, Hyunok. Can you stop sharing the screen? Then I can give everybody to see face to face, and then
stop sharing.
We'll do. Yeah. Wow, fantastic. I hear and I learn a lot, and thank you very much for that presentation. Lots of questions. One of them is love to hear your experience as a migrant. Has your migration journey shaped how you look at trauma or trauma in the foreign country, which is totally different to where you come from? What do you think?
Can you ask the last bit again? So what
is it like trauma, how you look at trauma or trauma in a foreign country, which is totally different?
How do I see different? I think the kinds of protectors that I have created in me, and I'm just using my own example, right? That's something that I can tell without consent. So I guess it's more protectors have created after migration. Yeah, I mean inside of me. So I sort of killed some of the Koreanness. It's still there, but I have to shut the mouth up. No, I mean the Koreanness, to be silenced. So I can be more active. I can be feeling more comfortable to put myself forward. So that kind of protectors inside of me that I have created during my migrant years, very helpful. But I also, the more the more the time goes over, I also really appreciate what I've got as a migrant, as a Korean woman. And it's beautiful to notice and recognize and having some connections. Yeah. Yeah, I have written or said something about hybrid identities for migrants some time ago. So it's more like the culture of origin and my new the country, my identity, the new country, they are somehow coexist, and they are negotiating every day. It's not only one negotiation that's had, it's a daily negotiation even inside of me, the Koreanness of me or the Kiwiness of me, and there is always something else. It's not Korean, it's not Kiwi, but there's also something else who's got eyes for both who's got perspectives about both. So I think the just the internal system gets a little more messy, but in a functional way, and that makes me richer, but sometimes makes me a bit lonely because I don't really feel Korean enough when I'm in Korea. I'm never been back 100% Kiwi, even if I'm in this country. So it makes me a little bit lonely, but loneliness is not always bad, right? And I guess sometimes I met people sharing this loneliness. It's nice, it's if that stands.
Thank you.
Like
so one of the last question was which is it okay to share the resource on hybrid identities? That's one of the questions, as well as your PPT.
PPT is fine. Yeah, the hybrid stuff. It's my doctoral thesis about 10 plus years ago. I don't know whether. Yeah, I don't think anyone wants to read the whole thesis, right? I don't want to read that.
Yes.
Yeah, maybe extract it somewhere in Google. When Google my name, it seems like it's coming up. Yeah, I will find the abstract and send it to you, Joanna.
Thank you very much. So loved your example. So as a woman, do our normal everyday upbringing influence the impact of trauma? That's one question. Like the older woman may feel less traumatized or may not identify that trauma compared to someone who has lived in a more modern, progressive identity. Society. Yeah.
So the question was whether she's going to be okay.
Yeah.
Whether she's
Is it as a woman, do our normal everyday upbringing influence the impact of the trauma? Somehow that intergenerational trauma talk about as well as the current.
Yeah. How come we don't influence our kids? Yeah, we do. Yeah, and and I was influenced by mom, but I'm glad my mom was sticking around. Yeah, I think we do influence our next generations, and we are influenced by our earlier generations. It's there, and the hope we have is that we may recognize the burdens that we carry from intergenerationally. Like for example, if the woman may say, "Oh, actually, I shouldn't voice myself. I should be." Compliant. That's the burden, right? So if somehow come in in the society or in the community, we can actually pay attention to the burden and find a way for the woman to be a little bit less pressured by the burden, then it would be nice. And if that happens, we have less likelihood of mindless transmission of the burden to the next generation. We way. I don't think we can stop altogether, but if we can do it a little bit more mindfully, so that sometimes you can apologize, sometimes we can try something new, sometimes we approach other people, how they are doing, sometimes we become more creative to find some different ways, then I think the burden can be a little bit dissolved. Rather, whatever the thing is, it's in a secret and closed space, it gets bigger and heavier. But once it's in open space, it's lighter, right? So I think just keep talking about those things in open space, and I bring those women in a more open space. I think yeah, I don't know whether it's going to be the answer, but I think it's good for us to think about it.
Yeah, ongoing. Yeah.
Yeah.
There's several questions related with how can we heal generational trauma? Is it possible to heal as an individual, or does it take generation to heal?
So I don't really have the exact sort of research that I can think of. There may be, yeah, but you know, like for example, the therapy models like IFS, EMDR, or many therapy models nowadays, they start looking at those intergenerational trauma. You can't go back to the 100 years ago, but we can let people know that actually it doesn't belong to you. And if you ask someone, oh, that belief, where it came from, does it belong to yours? And someone may say, oh, no, it's from my mom. I don't know, it's from somewhere else, but it doesn't belong to me. But I think it has power on me, you know. So whenever we found those legacy burdens, I think no, we can help them to let it go back to where it belongs. And no, also we know that even our ancestors know that we are suffering from the burdens. I don't think they like it. They are happy to take it back to them, if that makes sense. You know, someone talked about shamanism. You know, I think that's the wisdom. No, that's the wisdom from our ancestors. They knew, you know, those legacy, those generational legacy that our next day don't need to carry. You know, things change. So, but yeah, the way how we do it, it's a little more complicated, I think. But yeah, just borrowing the ideas, the wisdoms from traditional therapy, integrating with what we know from our science, the science in this time, it will be beautiful.
Thank you. Vani just to share with us, but unfortunately chat room is not sharing everybody, but Gabor Mate, that's Gabor, Dr. Mate has written many books, intergenerational trauma healings. So if you are interested in, and look out for Gabor Mate.
Yeah, yeah.
Thanks.
And his movie too, right? His movie is beautiful.
Yes, his movie. It's out now.
Wisdom of Trauma.
Yeah, Wisdom of Trauma. As a community worker, are there any strategies or tools we can use to overcome trauma when working in groups? Something like a group trauma tools or practices. Do you have anyone?
Yeah, it's depending on many things, right? I'm thinking, yeah, I personally like to have more groups who teach how to breathe, how to move our body. You know, even if we just, you know, and you know, something like this. So I'm just rearrange, you know, our spine, our breathing, you know, the air pathway. So something very basic, yeah, because it's also antidote to trauma, right? Because closed, we get closed and crunched, smaller, secretive. But if we somehow learn with a little courage, you know, the group can provide a little protection if there is some bonding in the group. Then you know, then we may just be able to look around a little bit, oh, maybe a little safer, you know, and then you may just no, the sound and movement and the breeze. You know, I think that I like to have those groups in the community a little more. So myself and my families and my kids, you know, they can go to those groups whenever at school or in the community, so that they actually learn those things to regulate ourselves and to feel safe in the group. So that's kind of ideal thinking that I'm having. But in the mental health settings are more like in a groups dealing with people struggling. Yeah, I'm still thinking, there are lots of things out there like a trauma-informed yoga, or lots of somatic approaches that we don't need to information about trauma, but we can help their body to have a little bit of space, just a little bit of space. Yeah.
Thank you very much. We will wrap up with this question and answer session. If you have a burning desire of asking question more, could you write down on the chat box, and we can deliver as much as we can. One of the chat was, thank you, Hyunok. Love and connection heal trauma beautifully. Thank you very much. And one was very informative presentation with the honest reflection. Thank you. Thank you very much.
Thanks a lot. So it's so nice to probably to meet like this. Yeah.